All right, hello everyone, and welcome to today's webinar on NIEHS activities, tools, and resources to protect workers from COVID-19. I'm Cain, Executive Director at CPWR, and I'm really happy to open today's webinar. It's part of our bi-monthly CPWR NIEHS webinar series. But this time, we're very happy to welcome this event in partnership with the National Institute of Environmental Health Sciences, or NIEHS. With that, I'd like to hand it over to Chip Hughes, who directs the NIEHS Worker Training Program, and who will introduce our NIEHS panel and kick off today's presentation on their COVID activities and efforts. Chip, it's all yours.
Thank you, Chris. Yeah, we're so excited to be here. I know I've been a lurker and a participant in your webinar series, and I've been so impressed by the level of presentation and the level of dialogue. So we're humbled to be able to be part of this today. I'll just say before we start, I feel like obviously we're in a dark period. We know that workplace transmission is probably both the Achilles heel of the pandemic and also the area where the most can be done to prevent transmission. And we know that's not been the case with the prior administration, and we hope it will be the case with the new incoming administration, that they will understand the importance of workplace transmission. I just wanted to say the worker training program, has been going now for over 30 years. We actually had the wonderful opportunity to receive an appropriation early on, back in February, to be able to build a library of information and an infrastructure of trainers. So what we want to preview for you today is to tell you a little bit about the journey that we've been on to build a COVID-19 training infrastructure in the country that's focused on workforce transmission, stopping workforce transmission. A big part of our journey has been to build a virtual safety training initiative that we've worked to leverage our infrastructure, and CPWR has been a big part of that, to be able to build socially distanced training delivery, and to make sure that we do that within a framework of knowing the effectiveness of training. We've also been working to rebuild a classroom delivery infrastructure to make sure that training can actually happen safely. We've also built virtual training platforms and virtual classes that Jonathan Rosen from our clearinghouse and Deborah Weinstock from our clearinghouse will be going over with you. So our hope is that our resources can help you think about how to fight the next stages of the pandemic in whatever community setting that you're in. And also, as we have done over the past 9 months, we've tried to refresh our information, and through our own webinar series, try to keep current on the data that happens, that becomes real, and what it means about how we respond in terms of best practices. And we're going to continue that with our next upcoming webinar series that'll be happening this winter. I wanted to say a little bit about kind of the challenges that we've had over the past 3-month period, I'll say, which is how do we actually continue to do socially distanced face-to-face training safely, since we know that many workers, particularly in the construction industry and a number of industries, continue to go to work every day. So that's made us know that we need to figure out how we can keep safety training happening for workers who are working every day. We tried to build a capacity to communicate honest, evidence-based information to frontline workers and their communities, sorting through a lot of the information, disinformation, misinformation, and updated information that comes out every day. We tried to broaden our train the trainer process to increase our digital training response capacity. And most importantly, we've tried to build our resilience training and build social support into all of our training activities. So that's a little background on us and what we've done. And I next wanted to turn it over to Deborah Weinstock, the head of the National Clearinghouse. Deborah?
Thank you, Chip. As Chip said, I'm Deborah Weinstock. I'm the Director for the National Clearinghouse for Worker Safety and Health Training. I'm going to start out today. I wanted to just give you a little bit of an overview of what the Clearinghouse is and what it does for those of you who don't know. And then I'm going to go ahead and move into our COVID-19 specific resources and materials for you. So the National Clearinghouse supports the Worker Training Program staff and the grantees, and it's a resource for the public on hazardous waste worker issues and disaster response. The most public-facing tool that we have is our website, which provides a lot of resources, and I wanted to cover a little bit of that with you before we move on to the COVID information. You can see, starting with the second bullet here, the various main topics that are covered on the Clearinghouse website, and you've got the address at the top of the slide. I'll spend some more time on the curricula catalog, the hazardous materials page, and disaster preparedness in upcoming slides. But the other main pages cover issues around environmental justice with subpages on brownfields, green jobs, and right to understand, emerging issues like alternative energy, climate resilience, fracking, and nanotechnology, training development with subpages on development of e-learning tools, the minimum criteria, training evaluation, and training methods. And then there's a section on news and resources that includes a direct link to our booklet order form, Clearinghouse publications like annual reports, and direct links to workshop reports that we've done. There's a multimedia page with videos there, and you can find information on Worker Training Program history and assessment, which includes things like our strategic plan and logic model. We also have a curricula catalog, which allows anyone to search for curricula that was developed under the Worker Training Program. The slide shows the form that you can use to search the curricula catalog, which you can search by various categories. So under course categories are things like asbestos abatement, hazmat transportation, infectious disease, educational enhancement, and emergency response. You can search by program, which would be hazardous waste worker, Department of Energy, environmental career worker training, hazmat disaster preparedness, and infectious disease. You could search by grantee, and under grantee, there's specific training provider if you're looking for a specific consortium member. You can also search by language, and/or you can use specific search terms. So this is just an example of some of the subpages under the hazardous materials section of the page. We've got chemical exposure, which includes, among other things, our chemical incident response training tool and a hospital-based decontamination curricula. DOE site cleanup includes a paper on safety culture in the DOE complex, training needs assessment, and a DOE NIEHS program evaluation report. Under illicit drug exposure, it includes information on the prevention of occupational exposure to fentanyl and information on illicit drug labs and meth lab cleanup. And then you can see there are also pages on mold exposure, radiation exposure, and Superfund sites. So the Clearinghouse has developed a number of different training tools in response to disasters. Training tools are essentially awareness level PowerPoints on how workers can be protected in the aftermath of various disasters, or in the case of COVID-19, in an ongoing pandemic. The training tools can be used by trainers who can customize them to meet their needs, the needs of their specific training audience. So with a PowerPoint, it's easy to remove or hide slides you don't want or need to use, and to add more graphics or information that speak more directly to your target audience. We often convert the content from the training tool into a booklet so workers can use them as reference guides after the training. You can order these booklets through our website at no cost, and so on the slide what you're seeing on the left is an image of the booklets that can be ordered from the website. So you can also see all the different topics that we have covered. Next, I wanted to just talk a little bit about our disaster preparedness app. And first, I wanted to give a big thank you and shout out to CPWR for allowing us to use their app platform so we could get these materials out to folks using either iPhones or Androids. The app takes the content from the training tools and booklets and allows workers exposed to hazards on disaster sites to access awareness-level training resources with a simple tap of the screen. Once downloaded, the materials can be accessed anytime, anywhere, with no internet connection required. All right, so here's what you've really been waiting for, information on our COVID-19 resources. Before I start, I do want to note that there's no specific COVID guidance for the construction industry, and that for all of these materials, it's just covering basically general industry for the most part. So I just wanted to make that clear. So under the disaster preparedness and response section of our website, under infectious diseases menu, you can find our COVID-19 resources, and you'll see the direct link at the top of the slide. In addition to the general awareness training tool and the essential and returning workers training tool, which Jonathan is going to focus on, we've developed a COVID-19 toolbox. We've included awardee resources, links to our webinars, and more. In addition to a recording of the spring workshop we held on infectious disease back in March, we also have videos of all the webinars that we've held, including our technical topics related to COVID-19, including topics like workplace outbreak investigations, contact tracing and testing, and minimizing workplace exposures through design and engineering controls. We also held 3 sessions on training best practices in the time of COVID-19, which focused on issues identified in our COVID-19 training needs assessment. So the general awareness and essential and returning worker trainings are available in English and Spanish, PowerPoint, and PDF. And we worked with Vivid Learning to put the content from each of those courses into an online asynchronous training. To date, more than 12,000 people have logged on to that training, and more than 8,500 completed an evaluation of the training, which found that 91% said the training prepared them to recognize COVID-19 hazards on the job, and 87% said training increased their knowledge of how to control COVID-19 workplace exposures. In the toolbox that's on the site, we have a COVID-19 resource list. This is a 14-page resource list, which is obviously an extensive list of the resources that were used in the basic COVID-19 awareness course development. But don't worry, it's divided into sections, so you can find the resources you're looking for relatively easily. The sections include guidelines by industry, CDC testing and exposure guidelines and return to work criteria, OSHA guidelines and standards, cleaning and disinfection, research, fact sheets, respiratory protection and PPE, workers' rights, cases, death counts and maps, hand washing, training materials, union resources and websites, and resilience materials. The Protecting Yourself fact sheet is a simple 2-page fact sheet with basic information on COVID. I'm going to skip the checklist for now and refer to it in another slide. Same with the COVID-19 pandemic is fueling the opioid crisis fact sheet. Can the SARS-CoV-2 virus be spread by blood? Answers these questions. How are bloodborne pathogens like HIV different than SARS-CoV-2? How are bloodborne pathogens and SARS-CoV-2 transition similar? And what should you be doing differently? Preventing SARS-CoV-2 eye exposures and infection provides detailed information on why eye protection is essential to protecting workers from exposure to SARS-CoV-2, the reasons for inadequate use of eye protection in the past, and what you can do now. There's an evaluation tip sheet and resources document that covers what information NIEHS-funded training programs can be gathering for program improvement, reporting, and accountability. It also provides a number of sample evaluation questions to use both immediately after training and 3 to 6 months post-training. Technology tips for virtual meetings and interactive online training sessions covers logistics, what to do before the training, ideas on being engaged, ideas on being an engaging presenter, facilitator, and on using interactive tools like polling and breakout rooms, and what to do post-training. And we also just posted the report from our WTP COVID-19 Training Needs Assessment, which talks about the challenges of transitioning to online training, the best practices and lessons learned during the transition. So I wanted to spend just a little time talking about this workplace checklist that we put together. It's available in Spanish and Vietnamese in addition to English. It can be used by employers, unions, and workers in non-healthcare facilities to assess workplace exposure and identify prevention and control measures for SARS-CoV-2. For each item, those who are completing the checklist can check yes, in progress, no, or not applicable, and there's a space to add detailed notes on things you want to follow up on. It's broken into several sections. There's a section on exposure control plans, measures to maintain social distancing, engineering controls, work practices, enhanced cleaning and disinfection, PPE and respiratory protection, sick leave, symptom screening, and employee health, exposure and case reporting, and measures to protect employee mental health and physical well-being. So now I've got a polling question. So it's a polling question regarding mental health, and you can go ahead and just check all that apply, and you can see it in your chat box.
All right, so we've had about 170, 64% of our attendees have finished responding, and it looks like the highest response was for option A. I don't know if you could just go back a slide real quick. So option 1, I have noticed an increase in worker stress. We had 98 people select that option. 24 people have noticed an increase in alcohol and drug use during the pandemic. 71 people believe training may help address these issues among workers. 66 selected all of the above. And 3 selected none of the above. And now we're still getting some numbers in, and we're now up, just to note, 101 people have selected the first option. So that definitely seems to be the most popular choice, and everyone is noticing increased stress.
Great. Thanks so much, Jessica. I appreciate it, and thanks for participating in the poll. While there is no real-time national counting of opioid overdose deaths, in the last several months, at least 30 states reported increases in opioid fatalities since the start of the pandemic. And so that sort of reflects some of what folks are thinking and seeing. So we've developed a fact sheet to talk about the link between the COVID-19 pandemic and an increased risk of opioid misuse. Some of the reasons that that's happening that you can see on the slide, and it provides tips to manage stressors caused by the pandemic. So the Clearinghouse also previously developed resiliency training for disaster workers, supervisors, and caregivers, and accompanying fact sheets to help workers cope with mental health impacts that they may face following a disaster. And the materials are very applicable for the pandemic as well, so I would encourage you to check those out on the website. So with that, I think I've pretty much used up my time, and I'd like to pass it over to Jonathan Rosen, who will talk about the 2 WTP COVID-19 training tools.
Hello there. Just to give you a little bit of information, I am a certified industrial hygienist. I've been working with the Clearinghouse for 8 years, and I've spent my entire life working for the labor movement. I also am providing support to a number of labor unions on COVID and opioids and other safety and health issues. So that's about me. And just to get started, since we're talking about workplace training, we have a polling question here that just popped up on the right-hand side. And so regarding worksite training on SARS-CoV-2, that's the virus that causes COVID-19 disease, please select all that apply, A, B, C, and D. And now we're supposed to have the little musical background, do-do-do-do-do-do-do-do, you know, while we're waiting for the results. And I just want to say that I've done a lot of the curriculum writing and also been fortunate to do instructor training. And I have worked with some construction unions, including CPWR and the operators and UA and others. And while we're waiting for the poll to come in, one of the things that I want to mention is that the training programs that we've created are not industry specific. The design of them is that people in different industries, whether it be construction, manufacturing, or the service sector, can take the core material that we've developed and then make it specific to your industry. I do have a few slides at the end that are specific to construction. It's just an example of how you can tailor the program to meet your specific needs. And I'm a big proponent of that. I think for worker training to be meaningful, it does need to be tailored not only to your industry and your occupations, but to your specific employment. Can we take a look at the results, or do we have enough of a response yet, Jessica?
We do. I think I just figured out how to share the results with everyone, but I'll go ahead and just read them off again. So once again, we had the highest number selected, the first option, that workers in my union or industry have received training. And of the 150 people who, or 149 that completed this survey, 93 people selected that option. 69 of the people on this meeting helped organize or plan the training. 34 would like to organize and plan a training for workers in their union or industry, and only 6 said training is not needed.
And one comment that I would make is we have been trying to get an OSHA standard on infectious diseases for more than a decade, and it was moving under the previous administration, but it was put on the side of the table during the recent administration. And part of that would be a requirement that workers receive training. Now, there's a number of states that have issued emergency temporary standards on COVID-19, Oregon being the most recent one. New Jersey is another, West Virginia. There's also a number of governors that have issued executive orders, and some of these workplace requirements include a requirement for worker training. And I'm a strong proponent of that. I think workers have a need to know about what the safety and health measures are in their workplace so that they know how to protect themselves, their co-workers, and the people that they interact with. So I mentioned that this program is not a operational training. The little black box was supposed to be a pop-up after the original slide, so pardon me for that. But what it's saying under there is that the operational training would be training from your employer about the site-specific safety and health procedures in your employment. That's not what we're doing here in this program. You have to add that to this program or supplement it with employer-specific training. And this caution applies to both of the programs that I'm covering for you today. The first one is Protect Yourself from COVID-19 in the Workplace. And by the way, this program is being updated. And this one is basically an awareness program for responders. And here are the goals and objectives. You're going to learn about the basic facts about the virus. You'll be able to explain them after you go through the training and define key steps in worker protection and infection prevention and control. It's designed as a 4-hour course, but like all of our courses, you are free to modify it, not only to make it industry and worksite specific, but you can shorten it. If you only have an hour or two, that's okay. You can streamline it and try to get to the most important information. There's a fact sheet that Deborah mentioned on the basics, which can replace a number of the slides. So that's one way that you can shorten the program. That's in this fourth box here. Employers have the responsibility under the OSHA Act to provide a workplace free of recognized hazards that can cause death or serious harm. There have been at least 3 OSHA general duty violations, I think mainly at meat packing plants since COVID broke out. There have been other violations of the respirator standard and the record-keeping standard. But because of the fact that there's no OSHA infectious disease standard, a lot of people are complaining to their state health department, the mayor, or the police. But the point is that if we're confronted with the hazard of being exposed to this virus, we have a right to speak up, and we need to be able to protect ourselves and our members. So here's the course content. We have links to a map on the worldwide number of cases, and Module 1 covers basics about how the disease is transmitted. And sorry about that. Also the incubation period, symptoms. It defines a person under investigation, a confirmed case, survival of the virus outside the body, which is important in terms of environmental cleaning, and a comparison to influenza. Module 2, we cover assessing the potential for exposure in the workplace, and OSHA has developed a scheme, high, medium, and low exposure categories that we use. The community and the workplace connection is a very critical point. Right now, we're seeing accelerating cases in the community. That's going to affect the workplace. That's the point of it. And so the protections in the workplace may have to be modified when you have accelerating community cases. Very important point. Exposure reporting, again, we're finding in some workplaces the employer is notifying workers, especially where these standards and executive orders are in place. But in other places, employers are not notifying the worker. And this is a basic right for workers to have the right to know, so that there can be follow-up and contact tracing in cooperation with public health authorities. Module 3 covers methods to prevent COVID-19 in the workplace, a workplace plan, use of the hierarchy of controls with examples, relevant OSHA standards. Practical steps are emphasized, such as social distancing, mask wearing, avoiding crowds, etc. Hand washing, cleaning of tools is an important one in the construction industry. There are examples in these slide sets that can be omitted because they're not relevant to the construction industry. We also review the NIEHS Pathogen Safety Data Guide and Training Module, which was produced during the Ebola outbreak. And the idea of that is, like with chemicals where you have a material safety data sheet, there should be safety data sheets for infectious disease hazards. The Canadian Public Health has developed 200 of these, which are standardized. We also cover in this training how to use your smartphone to look up any infectious disease hazard that you might be concerned with on the job. For example, do you run into a job where there's a lot of pigeon poop? That poses the hazard of histoplasmosis. Or are you working at a facility that deals with, a waste treatment facility? There could be a problem with exposure to hepatitis B or hepatitis C. So the idea of this training is whatever you're concerned with, you'd be able to look up and learn how is it transmitted, how do I protect myself? And of course, the mental health issues are extremely important with COVID-19. So that brings us to the next polling question regarding COVID fatigue. And what I mean by that is people getting tired of complying with the safety measures. So the question is, regarding COVID fatigue, please check either A or B. We have heard reports of workers fighting with each other about mask wearing. We have also heard reports about bus drivers getting stabbed because they tried to enforce mask wearing on their bus. So this is the kind of thing that's happening, and the politicization of these standards has been a real problem. We want to base these measures on science, and that's what NIEHS Worker Training Program has done with these training programs. Underneath the slides in the instructor notes are all the scientific references and lots of information to help instructors present this material. How are we doing for responses, Jessica?
Yeah, I haven't closed it yet. We're still getting a number in, but unfortunately, the second option has a few more than the first. So about 67 people so far have selected the second option in comparison to 55 who have said that workers are diligent.
Right. So, I mean, this is not really surprising. A big issue with the mental health effects is social isolation. And, you know, you're locked up at home, you can't see your family, you can't visit your loved one at the nursing home, at work, you have to stay away from your coworkers. You know, this is very demoralizing. And having to wear all these protective equipment and procedures can be very grinding. But the problem is that we're seeing a huge increase in the number of cases and deaths. And again, this is why we need a federal standard and a federal strategy to fight the virus. And we're going to have to really try to get folks to understand that it's essential to their well-being to practice these safety measures. So the second program, which is more comprehensive, is entitled the Essential and Returning Worker Training Tool. This one is being updated as well. And it is a 4-hour program, but again, you can tailor it, you can shorten it to meet the needs of your specific audience and your specific work site. The objectives are similar to the first program, but it's a little bit more detailed about the work procedures. The agenda includes 4 modules, which are listed on the slide. Here's the detail in the introduction. And one thing that we have found is if you're doing training virtually, getting participation using polling questions, small group activities is really a great way to get people to engage in the content. There's a video on hand washing, which runs for 2.5 minutes, which is really quite good. This is kind of the basic worker protection stuff that's in here. And I know in the construction field, a big issue is the burnout people are having about mask wearing and also the challenge of doing the work safely and physically distancing. Here's Module 1. Transmission's very important. There's more and more evidence that aerosol transmission through inhalation is the main way that the virus is making people sick. Understanding the exposure factors is very important, assessing the risk, and then coming up with a plan. How are you going to communicate that with the workforce? That's very critical. So in terms of the assessment, this is the model that's presented in the training. It's probably familiar to you. Module 2 covers exposure prevention. And we do have information examples using photos. And one thing I would say that you could do with this module, you could use your own photos from your own job sites to illustrate safety measures, safety protocols, or what's wrong with this picture. Once you've selected the safeguards and determined the results of the hazard analysis, then you're going to want to select your control measures using the hierarchy and be sure to evaluate and make adjustments as needed. This is really Safety 101. So here's an example of using the photos. Are these adequate? The one on the right is a New York City bus. And you can see they put up a chain to keep passengers a safe distance from the driver. Is that going to be adequate? And really, there's nothing to keep the passengers apart from each other. So you can put in the chat box if you think that that's a yes or a no to that picture. The picture on the left is a healthcare worker, and it looks like the healthcare worker is wearing maybe a surgical mask and not an N95. So that would be a concern depending on whether they have patient contact or not. Here's another example of using the photos in training. On the left, we have a New York City police officer wearing a surgical mask. Notice he has a beard, which even if he didn't have the beard, there's going to be leakage between the sides and the top and the bottom, and the filtration of the mask itself is not going to be the same as for an N95 or a better respirator. Notice that the officer has no gloves on. So that's not adequate protection in my opinion. What do you think? Would you give that a yes or a no? On the right is my buddy who I work out with at the gym, who works at the local post office. I don't know if you can see it, but they have plastic strips as a barrier. Do you think those plastic strips are going to prevent submicron virus particles from getting into my friend's breathing zone? And notice that he's not wearing any mask or respiratory protection. I'm concerned about my friend's well-being. What do you think? Is this a yes or a no? Feel free to jump into the discussion. We're getting a lot of comments here, which is great. I'm just going to take a look here at the chat box, catch my breath. All right, doesn't prevent airborne transmission. Chain is inadequate. People can step over the chain. Yeah, not enough protection, etc. So I think these photos are a really powerful way to get people engaged. I'm going to move on to the next section, which is on cleaning and disinfection. There is a guide from Milwaukee Tool about cleaning of tools. It's probably available on CPWR's website. If not, we'll share it so that they can get it to you. You can see the content in this module. This is an important topic, obviously, and you're going to want to have site-specific procedures on cleaning and disinfection. By the way, cleaning is a different step. Cleaning is removal of debris and dirt, and then disinfection, you want to use a EPA-approved disinfectant. There's a list, and that's referenced in the training materials that's effective on SARS-CoV-2. Module 4 covers mental health and resilience, which is another very critical topic to be covered. We already mentioned that people are stressed out, and that was indicated in the polling question. So what can you do about that? Well, one thing that we recommend is it's as easy as going up, not within 6 feet, but communicating with a coworker. How are you doing today? How are you okay? If you see somebody struggling, give them your ear. You don't have to try to fix it. You don't have to try to tell them what to do, but just showing them the concern can make a big impact and a big difference to people. We have a training program, and I believe some of the construction unions have developed training on these issues. There's also EAP resources. There's also the issue of opioid and drug use and suicide. CPWR has been a leader at addressing these issues. Please visit CPWR's opioid resource website. It's fantastic. They've got an incredible training. And the reason that I mention it is that when people use drugs, alcohol, or commit suicide, we really see that as driven by stress and mental health. And those are considered, substance use disorders are considered diseases. So that's something that's really tied in with the pandemic. In some cities like Buffalo and New York, they've had a doubling of overdose fatalities and a big increase in suicides. Now, here's an example of making this construction specific. Where are the choke points in your workplace? This picture we got from CPWR, but you could ask your participants in your training to identify choke points at their construction site or at their building or operation, and that would be a good exercise in the training, and also to follow through and make sure that they're corrected. The picture on the right, now that's the traditional safety toolbox talk, but what's wrong with that picture? Well, people are too close to one another, and they're not wearing masks. That's why we have the stop sign on it. Does that mean that we shouldn't have safety communication? Of course we need safety communication. So how are you going to do it safely? I would love to hear in the chat box of any suggestions or ideas people have or practices of how to do a safety stand down or toolbox talk safely in the time of COVID. Please throw that in the chat box while I keep covering this material. These are the typical types of job and lifestyle stressors that members are experiencing: layoffs, job loss, concerns about income, health insurance, fear of infection or infecting the family, illness, and death. And we're getting some responses. Yes, if you're outside, that's a good thing because the great outdoors is the best ventilation system in the world. But if you're close to somebody, you could still transmit the infection. You still need to maintain that distancing. Good example was the Rose Garden super spreader event. When the Supreme Court Justice was sworn in, a lot of people got infected even though they were outside. Yeah, we've got some great suggestions here. I'd love to capture that. I think that would be great to share with the community. And then taking a look at union resources. EAP, are people using it? It's a good idea to take a look at utilization and see how many people are using it and for what purposes. You don't want any personal identifiers, but you can get blinded information. Member assistance programs, when you're training peers to be that outreach at the work site, it's very effective. One of the limitations on EAP, they cannot approach a worker who's struggling. But a member assistance peer trainer, they can go up to a coworker and say, how you doing today? Are the benefits adequate? That's a big issue. And we can make compelling arguments with management to improve behavioral benefits and substance use benefits because it's cost effective to do so. And then connecting with community resources for mental health and substance use. And the program ends with an action planning, and it's both on an individual and a group level. So if you're an individual worker, you might not have the ability to influence the organization's policies and procedures, but you can maybe report job hazards, share fact sheets. Maybe you can be a little more compassionate with a coworker who's struggling. If you're a union official, you can look at more of the organizational level activities. And with that, I'm going to conclude my part of the talk and turn it over to my great colleague, Sharon Beard, who's an industrial hygienist with the Worker Training Program, who's going to moderate the questions and answers. And I do see some questions in the chat box, Sharon. Take it away.
Thank you, Jonathan, for the great presentation. And we're going to start with one of the questions. Jonathan, one was assigned, what was the Santa Clara checklist that was on your slide? That was one question.
So Santa Clara was one of the first counties to pass a requirement for businesses to go through this checklist, which documents that they've assessed the workplace, social distancing, requiring masks, and other control measures, and it has to be signed off by a management official. And so that was a good example of having a regulation requiring that these things be done. I can tell you in New York, they've been enforcing some of these regulations. They've shut down some restaurants and bars that weren't enforcing the rules, and that's because restaurants and bars have been a major source of the spreading of the virus, and also it's causing the restaurant and bar workers to get infected.
Thank you, Jonathan. There was one additional question with the picture with the cop wearing the gloves. The question says, is there science on the spread of COVID-19 from touching a surface and spreading? I thought the main transportation was respiratory, which can lead to misconception.
Yes, the science shows that the virus survives on different material for different amounts of time. It can be for hours or even days, depending on the type of material. We have those studies referenced in the training instructor notes. The point about contact is if you touch a contaminated surface and then you touch your eyes, nose, or mouth, theoretically you can get infected. The emphasis is on inhalation, but we still want to wash our hands and disinfect and avoid touching our eyes, nose, and mouth. But we don't have great studies yet about the mechanism of that, other than knowing that you don't want to put virus in your eyes, nose, and mouth.
Thank you, Jonathan. There's another question that says, many employers don't pay their workers who are out from COVID, and the rationale is that they may acquire the illness outside of work. How do you deal with or encourage, folks to deal with this even if they're feeling sick?
Yeah, that's a hard question. I can say that in some states, the unions and some of the public health advocates have gotten the legislature to pass laws presuming that if you get COVID, that it's work-related under your workers' comp system. And I think you can access that information. There was a list developed. We have a copy of the list developed by Glenn Shore from California. So that's an issue. You could find out if that's been done in your state. But on a local level, it's a matter of if you think it's work-related and you have evidence, for example, you know of what we call the index case, that would be the source of the infection, then you have a right to file a workers' comp claim. And you also have a right to pursue benefits that your union's negotiated. But you would try to develop evidence. So, for example, my daughter-in-law is a nurse, and one of her coworkers was taking care of a COVID patient that died. So that was the index case. So she had strong evidence that when she got COVID, my daughter-in-law's friend, it was related to that case. Not the full answer that I would like to provide you with. There's actually a real gap in worker protection in our country. Back in 1970, there was a recommendation for a federal workers' comp system, which was never realized and still is a need, in my opinion, today.
Great. We have a two-part question, Jonathan. Someone says, I'm being asked about temporary plexiglass office desk partitions. Is there any data or guidance on plexiglass office partitions, and if so, what height is appropriate? That's the first part. You want to answer that?
Yes. When we put together the training program, we looked for scientific information on plexiglass effectiveness, and we're unable to find any. Basically, you'll see that they're effective as sneeze guards. So you go to the restaurant, they're over the salad bar. Definitely that's an effective use if somebody's sneezing at you. But when it comes to preventing submicron particles that are suspended in the air, they're not going to prevent those particles from getting into the space that you're breathing in.
That second part of the question reads, should we do an airflow study to confirm the HVAC system is not blowing particles over them, and what test method should be used?
Yeah. I mean, that's definitely a very important point. We like to emphasize engineering controls, such as ventilation, but the problem is that every ventilation situation is unique. So it really would depend on what the design of the ventilation system is. Is it a centralized system? Is it a unit ventilator? Is it are we talking about a commercial building or a more of a residential style building? So there are a lot of guides out there, and we can get that information into your hands. You know, definitely you're going to want to find out the basics. How is fresh air introduced into the building? At what percentage is fresh air? What type of filtration is used? The recommendation from the American Society for Heating, Refrigerating, and Air Conditioning Engineers is to have a MERV 13 or higher filtration if the building is capable of that. But again, it really has to be tailored to the building, and you probably are going to want to work with either an industrial hygienist or a building engineer that has expertise to help you evaluate that.
Great. Thanks, Jonathan. There was another question on, is anyone advocating for OSHA to develop an airborne pathogen standard? I think this would be better than a COVID-specific standard.
Yes, I mean, for over 10 years, there's been actually a draft infectious disease standard which would cover aerosol transmissible diseases, and it was beginning to move when David Michaels was the head of OSHA under the Obama administration. So hopefully, I'm hoping that under the Biden administration that will be quickly moved upon, although nothing moves quickly in OSHA. I did see that getting an emergency temporary standard on COVID was a priority, I believe, for the Biden administration.
Another question is, let's find it here. How can the restaurants, et cetera, have been spreading COVID if they haven't been open, especially in New York?
So New York City was in phase 4, the final phase, and they did reopen, and they had rules, however. The rules are social distancing, limiting the number of customers. Also, the rules at the bars require that you have to order food, and the purpose of that is they don't want people bunching up. Crowding is a huge factor in the spread of the disease. So they just announced in the paper today that they're going to put more restrictions on the New York bars and restaurants because of the fact that the transmission is increasing.
All right, Jonathan, this is an interesting question. I'm thinking about this myself. Many have begun using ozone to treat construction trailers and indoor spaces. For $75, one can purchase a unit that treats 2,000 SF. Can you explain the science behind this treatment process?
I can share some reference material that I have. There's a lot of concerns because ozone can be a health hazard to the people that are exposed to it, is the quick, short answer. But if you want a much more detailed technical answer, I have reference material that I can share on that. There's also reference material that's been developed by the American Industrial Hygiene Association that addresses those concerns.
Yes, and we can add that information to the Q&As that we received beforehand that will be uploaded to the CPWR website. So thanks. Here's another question. How is an older worker compensated for lost hours because they can't tolerate some of the PPE guidelines due to pre-conditioned health issues such as asthma and other respiratory conditions? So
that's a tough issue. Initially, Congress passed the Family Cares Act, but the negotiations between the Democratic-controlled House and the Republican-controlled Senate limited the benefits to certain employment. So I don't have all of the details about that, but it did cover some people who were unable to work because of pre-existing health conditions and had to quarantine or stay off the job. So that's another gap that needs to be addressed, and some unions have been trying to negotiate those benefits and conditions. Some of the state executive orders and emergency temporary standards are addressing it, but it's another area where we have inconsistency.
Great. And I believe Amber Mitchell was able to post a link on the information on COVID-19 paid leave that was posted on the DOL. So please look at that. I think that might provide some guidance to y'all also. Another question, could you use a smoke test to observe airflow around plexiglass?
I have never used a smoke tube to observe airflow around plexiglass. I've used it to detect negative pressure in a hospital isolation room. I would think you could use it for that purpose, but I'm not sure that would work because usually you have to be fairly close to where the air is being exhausted or supplied to see the air movement sufficiently with a smoke tube or a piece of tissue. But it's certainly worth trying, I think, as a kind of a rank and file way of doing the work.
Another question, are the electrostatic sprayers effective in combating the virus?
I'm sorry, could you repeat that?
Are the electrostatic sprayers effective in combating the virus?
Again, we have reference material for that, and also the American Industrial Hygiene Association. I don't want to go into any detail on that, but I know that there have been concerns with that, also published on the EPA website. So I would just say that with all of these different methods, it's important to look up the detailed scientific references before you institute it, and looking at the strengths and weaknesses, and especially the potential hazards to the workers who are using these methods.
See, the next question I see, it says, if an employer allows a worker who has identified as having close contact with COVID-19 to return to work without quarantine or testing, can that employer be cited for a willful violation by OSHA, and are there other ramifications?
Today, I'm not aware that OSHA has received a complaint or acted on a complaint like that. I would say my knowledge of OSHA is that if there's no specific standard, the criteria for a general duty violation, you have to prove that the hazard exists, that it's a serious hazard, meaning that it could cause death or serious harm, that there's an industry standard, and that there's reasonable methods for control. So on the face of it, I think you could try to develop a general duty complaint based on those criteria, given the scenario that you just described. But it might hinge on the fact of whether, the person actually gets sick or not with COVID. I don't think anyone would argue if you get COVID that that's not a serious condition. But if you don't get it, I don't know if that would have an impact on whether they would consider it serious or not. It hasn't been tested to my knowledge.
Okay. And there was some other information that was posted about the ozone generators and how they should not be used in indoor spaces. There were some links to the EPA website, so I encourage people to look at those links. There was another question in reference to what recommendations and sources would you recommend for mitigation strategies for beauty salon workers. And, you know, just thinking about that, Jonathan, I would think that the normal precautions that you would use in a workplace setting that have been put out there by OSHA and on, you know, protecting workers, you would utilize those. But because they're within that 6 feet range, there is definitely chance of transmission because you're going to be close to folks when you're doing that type of work. But do you have any further guidance on that?
Well, you know, in that setting, you know, you are going to have more aerosols potentially because, you know, if you're grinding toenails and fingernails and you're using chemicals, you know, coatings and that type of thing. So that's a higher risk setting for both chemical and biological concerns. And so, you know, frankly, I wouldn't frequent one of those places right now with the escalating spread of the virus. But I think for the workers in those, you know, respiratory protection, masking and ventilation and the typical things that you're talking about should be in place.
Okay. Let me see if I can find the next question here.
I'm going to post in the chat box the AIHA website that has all their different guidelines for the different industries. It also includes cleaning and disinfecting. There is one on the construction industry that I haven't had a chance to read through, so I don't know if CPWR has reviewed it yet, but I'm putting that link there just for general usage.
Yeah, and also the link for hair and nail salon reopening guidelines was posted from the Back to Work Safely website from AIHA. So that information was also shared in the chat box.
Yeah. I just want to mention Amber Mitchell is our science advisor at NIEHS, and she's been so gracious as to post the links for some of the documents that answer your specific questions in the detail that I was not able to do.
The next question I see, Jonathan, if surgical masks are not protecting the person wearing it, shouldn't it be mandated that workers wear N95 respirators, which would require fit testing?
So, you know, this is the kind of the 800-pound gorilla in the room. We know that it's an aerosol transmissible disease through inhalation. We know that at least 40% of the people who are contagious are asymptomatic or pre-symptomatic, and they've done studies in nursing homes where 78% of the people were asymptomatic or pre-symptomatic. So the problem is we have a worldwide shortage of respirators, and the companies that produce the respirators are not going to invest in new plants, new equipment, and hiring the personnel to produce what's needed for respiratory protection unless the Defense Production Act is fully implemented. So that I think is the real problem. And with this shortage, CDC and WHO have said if you run out of respirators, you can use a surgical mask. Well, we know that scientifically you cannot get the same kind of protection from a surgical mask that you get from a properly fitted, sized, tight-fitting respirator. And frankly, if you're in a nursing home and there's escalating community spread, I think we're going to see a lot more death if we don't have everybody in a setting like that wearing a respirator. That's my personal opinion. And I think a lot of industrial hygienists share that opinion. But again, the dilemma is we don't have the respirators available. One solution to that has been using reusable elastomeric respirators. The filters on those you can use for up to a year without replacing them, as long as they don't get damaged or soiled. So that's one solution, which would eliminate waste. It's also more cost effective for the industries that use them. So that's something that NIEHS is also evaluating, and they have a request for information where they're going to be working with the organizations to, they're going to give them the elastomeric respirators as long as the organizations comply with the OSHA requirements, and then write up their experience piloting.
So I wanted to weigh in on this. This is Chris with CPWR. As far as respiratory protection, our position since April has been that this is an airborne disease and that workers who have to work in proximity should be protected in a full respiratory protection program with N95 masks or better. This is obviously a problem with shortage, as Jonathan described, with the N95s that don't have valves are being used and needed by our healthcare industry. But N95 or better means a lot of different things, including valved respirators for workers in close proximity, as well as reusable elastomeric face pieces, supplied air respirators, all of the above. So that's been our position from day one, and I just wanted to weigh in with that because it seems as though the government might be catching up to the reality that this is an airborne spread disease, and I just want to reiterate that as construction is moving indoors with the cooler weather, this becomes even more critical to pay attention to. One of the things that we've been struggling with, a lot of the questions that came in around ventilation, be it an office setting, nail salon, whatever type of workplace. We know very little about how to set up good temporary ventilation to control COVID in the construction industry, and we're actively seeking research partners to look at that issue. Because we don't know that much, we don't have a set of basic guidelines on what to do in a temporary work site that doesn't yet have an operational HVAC system in place, which the current guidelines talk about. The ASHRAE guidelines and other groups have good information on how to keep ventilation systems working properly. We don't even have that yet in construction in many work sites. So just wanted to beat the dead horse a little bit that this is an airborne disease. We don't know enough about how to control it through ventilation and construction. And we stand by our stance from April that if workers have to be close together, they need to be in respirators. Thanks.
Thanks, Chris.
That's awesome.
Jonathan, you ready for the next question?
Go ahead.
All right. This one, I think if we have a doctor online, we might want to get their input on this, but it says, as we all start living again, is it reasonable that case numbers go up while death rates go down as therapies get better?
You want me to answer that question?
No, that's why I said it might be we need to have a doctor on that, because we know that therapies are getting better as we've been fighting this disease for quite a long time. And so interventions in the hospitals, they're adding new treatments on a regular basis. There are a lot of stuff that's that's being utilized, but that could be the case. But I think from a medical perspective, we would need to get a doctor to weigh in on that particular question in reference to if death rates go down, with the therapies, would it be okay? So, I mean, I'm not quite sure about that, but it might be something, if we have a doctor online, that might want to try to answer that question. I just thought I'd put it out there because I haven't seen anybody try to respond to that yet.
Or you could maybe have Amber answer that question.
We'll see if she actually has responded at all. I'm looking here at any of the other responses. Let's see. Nope, I don't see it yet. We'll give her some time.
Jessica, is it possible to make Amber a presenter so she could unmute?
Yep, 1 second.
Sure.
Oh, you know what? It looks like, Amber, you must have called in. I can't identify you on the line, unfortunately. Oh, there you go. Okay.
Can you hear me?
Yes.
I was so busy answering other questions in the chat. Sharon, what was the question you need help with?
Sure. The question is, as we start, is it reasonable that case numbers go up while death rates go down as therapies get better?
Question, and I think it's really difficult now to know, but you're absolutely right. There's some great resources. The New York Times, both the New York Times and FDA have ongoing lists of therapies and therapeutics for SARS-CoV-2 and for COVID-19. So the therapies are getting better. But I would say generally that would be the case, that we would see death rates go down because treatments are better. But keep in mind, this virus tends to attack the organ systems that are more vulnerable. So people with comorbidities like heart disease, like diabetes, really it's the underlying health effects in those comorbidities that people have, or those other underlying health effects that are compromising their immune system. So that's going to be an ongoing issue, especially in the workplace for essential workers. So we really do need to think about our own health and safety and how we're managing through COVID with regular exercise and getting outside in the sunshine, and anything to improve our own immunity is really important.
But Amber, maybe you could address the RO issue.
So for transmission of the virus, we typically think about an RO value, which is, let's say if I have the flu, I may pass the flu on to 2 or 3 other people if I don't have the vaccination. For COVID, it's much higher than that. It could be 5, 7, 10 people. But what's important to note too is that if someone is asymptomatic, meaning they don't know if they have the virus or not, and they're actively coughing in a confined space, that's a very different issue than if we're working outside on a construction site where people can space themselves effectively. Something like measles or tuberculosis, one person could infect 10, 15, 20 other people. So COVID kind of sits right there in the middle. Once we have a vaccine, it may be a very different story, but until then, it's important to know, especially with those asymptomatic people, that it's seeming like they're infecting, potentially exposing the highest numbers of people because they just don't know they're virus positive.
And I think a key issue here is that we still don't have effective treatment. We don't have a vaccine, and this is a fatal disease, and so we need to suppress the curve. And the way you do it, social distancing, wear a mask, wear a respirator, as Chris was saying, when necessary, avoid crowds, etc. If we practice those things, we can suppress the curve and prevent the widespread infection of people. Now, with influenza, we have a vaccine, but we still have 30 to 60,000 people a year, mainly very old and very young, that die of influenza. That's not a unimportant hazard, but that's a big difference. We don't have the vaccine yet. We don't know how effective it will be. We're all hopeful, but at this point, we need to suppress the curve.
Jonathan, there was another question on, is anyone outside of OSHA reviewing and publishing information on OSHA whistleblower complaints related to COVID-19?
Well, there are a number of watchdog groups that I'm aware of that are doing that type of thing. National Employment Law Project is one. And there's others. I don't remember. That's the one that I remember.
And I also believe that NIEHS had done a webinar and had a couple of speakers that really talked about whistleblower complaints that was listed on the state websites for several of the Attorney General's offices in reference to help there. And we can certainly look that up and share that information also.
And I know that some of the emergency temporary standards have extra provisions on whistleblowing and discrimination and employment-related matters like that.
There was a question about the efficacies of N95s.
Right. The studies have shown that a lot of them are not capable of what they're advertised to be able to filter out 95% of submicron particles, and the studies are showing 40, 50, 60% instead of 95%. Also, most of them have ear loops, so you don't get a tight fit, which is means that you can have up to 20% leakage around the facial seal. And the other problem is they only come in one size, and people don't come in one size. So you really need extra small, small, all the way up to extra large to get a tight fit.
I think that might be all of the questions. Up here's another one. Nope, that's it. I don't see any other questions unless I missed some. Jessica, do you see any others that we may have missed?
I think you did a good job. I'll pull everything that was in the chat. So if we did miss a question, we'll be happy to follow up in my email, or I can always connect our attendees with our panelists later. But I think, one quick question just came in. Do you have the reference for 20% leakage?
I would have to pull that. I don't have that on me. No.
Okay. All right. We'll see if we can get that, share that later. So yeah, thanks for staying on. What a great Q&A, and thanks to everyone who's been contributing in the chat. Yeah. Any final comments from any of you?
Well, this is Chris. I want to thank everybody for being on. It was a good webinar.
Yes, thank you, Chris, for allowing us to come and share some of our tools and resources. And as we had said earlier, we're going to also have a series of webinars that we will post on our website. Deborah share information on how to get access to that. So please keep an eye out on some of those resources. And then also the NIEHS Clearinghouse news brief posts a lot of information that is actually coming out that might be of interest to individuals too. And so hopefully we'll have a posting within the next month or so with the listing of those new webinars that we're planning.
Great. Thank you.